Those range in cost, but from anywhere from $4,000 to $10,000 per month for an individual. The residential nursing facilities, which are more costly and more restrictive for the seniors. We have an aging population. People facing either themselves, the prospect of aging and what that's going to entail and what they're going to need, or facing possibly parents who are in crisis, who are in need of care.
You have enough workforce to serve elderly Americans.
The workforce is a challenging issue because there seems to always be a shortage of workers.
Broad aspirations to move from a clinical or a medical model of serving to a social model or a community model of serving.
Basis, at least in the statutes, is of a human rights-based approach. The role of care and care providers is to respect their individual autonomy, independence, decision-making as a primary focus.
Before we get started, please subscribe so that you never miss an episode of our cutting-edge contemporary conversations. Thank you.
Hi Kyle, how are you?
I'm doing good. How are you?
Doing very well, thank you. And thanks for joining us.
Thanks for having me.
Could you talk briefly on your work and your work experience and your life before we go on specific topics?
Sure, yeah. So I'm a general practitioner, attorney. So in that role, I sort of, try to meet the legal needs of people, small businesses, sort of all the general matters that come up. People might need a lawyer. So anything from, a house closing to a little criminal defense, or if there's a dispute contractually, or it could be trust in estates, kind of all over, all the basic cases that a lawyer would handle.
And what's your background?
So I grew up in Connecticut and went to school a few different places. I graduated from college with economics and English degree, went on to law school after serving a couple years in the Peace Corps in Cameroon as a microfinance, small enterprise development or small business development volunteer. And then I went on to law school after that as a way to, find a way to help people but try to make a decent living doing so. And then I pursued a degree at seminary at Yale Divinity School. And for a while I was a military attorney in the JAG Corps of the Army and Connecticut National Guard. So that was my background professionally.
Thank you. Could you talk more about, you were sharing with me earlier your work within the elderly care space and then your experience and your knowledge. And could you elaborate more on how does the elderly care work within the American context?
Sure.
And what are the bigger challenges you see with that sector?
Sure. So elder care in the American context, it's an important issue because we have an aging population. So a greater percentage of the population are facing the issues as the baby boomers begin to age. And elder care broadly comes into my office based on estate planning, people facing either themselves, the prospect of aging and what that's going to entail and what they're going to need, or facing possibly parents who are in crisis, who are in need of care, or individuals who don't have family members willing or able to put the services in place for them and care for them. And so one of the primary considerations is cost, and the elder care system, at least in Connecticut, is funded in one of two ways. And when we think elder care, there are a couple of different contexts, or a few, I should say. One is, I guess ideally people age in their home relatively independently or surrounded by family and loved ones and don't face, significant health concerns or difficulties in managing their finances or medical care needs. And then sort of middle of the road spectrum, we have assisted living in Connecticut, which is sort of a gradated or a graduated level of care. So these are more places where they might be apartments for seniors, but they have shared meals prepared or things like that, or they might even have some medical care on staff that is able to check and monitor, help with medication management or things like that. But by and large, the seniors are independent. They have their own apartment, can do their own activities, their own meals, free to come and go as they please. They might have some assistance with things like transportation and such. And those are, those range in cost, but from anywhere from $4,000 to $10,000 per month for an individual. Then you have the residential nursing facilities, which are more costly and more restrictive for the seniors, but they provide a higher level of care. So they provide things like bathing, dressing, medication, help with all activities of daily living. And then on the furthest spectrum of those facilities are locked memory care units where individuals are
with dementia.
And cannot, and aren't free to move because possibly they wander. So those are locked units. And the residential facilities vary, but they could be individual rooms or shared rooms, and there's a much greater restriction and also a much greater level of care. And those cost around $15,000 a month.
Wow! And could you talk on because, as you said, the aging population. How is the workforce? Challenges? Are there any challenges? Do you have enough workforce to serve elderly Americans? And also, because when you are having it's a contact sport, like a contact sport, you're having workforce who are working with you very closely with elderly Americans, and there is a nature of some form of there's a possibility of some form of abuse happening. So how does that? So talk more about the workforce challenges and also a bit more on the elderly abuse, if there is any.
Yeah. So the workforce it is a challenging issue because there seems to always be a shortage of workers, and that is based partly on the pay that the workers can receive. However, it's also based on the willingness of people to serve that population, the people who are willing or able. There aren't many barriers to entry for people who are willing to take on the work. And anecdotally, a large percentage of the caregivers seem to be first-generation immigrants. Now, that is true, I believe, in the context of both residential facilities and at-home care providers. And there has been a shift to at-home care providers or live-in care providers as the funding shifts and promotes those initiatives.
In Australia, we had a Royal Commission into Abuse for Elderly Australians, and which came out with a lot of recommendations, and we also had a Royal Commission, which is an inquiry, Commonwealth driven on disability as well. So to identify if there is violence, abuse in different settings. One of the things which came out as a recommendation was something called human rights based practice, and to implement, so to see this person as a whole and to move away from a medical model or a clinical model to, this you have a problem, let's medicate you, to a social or a community model. That's the broad aspirations, to move from a clinical or a medical model of serving to a social model or a community model of serving. So how is that understanding of, are we in the US, are you moving away from that kind of a service delivery?
In Connecticut, we are. That's the aspiration, and the basis, at least in the statutes, is of a human rights-based approach and an individual centric approach, so that the person has statutory protections, and that the role of care and care providers is to respect their individual autonomy, independence, decision-making as a primary focus. And there is a shift in funding that's happening away from institutional residential settings toward community-based care. But it's challenging, both in terms of, as you mentioned, the workforce and finding adequate people to provide the care, and also on the families that are sandwiched sort of between caring for children, caring for aging parents, and finding some balance when there is a significant level of care for the elder, because the nature of some of the medical challenges, such as dementia, make it an inherently difficult thing to do. So models are bound to be aspirational, but in the details, sometimes messy.
In the whole welfare state of the US, in which you are supporting people who are vulnerable in your communities, how is that welfare model working in the country for specifically people who are vulnerable, like people with disabilities and elderly people, and mental health as well?
Well, it has challenges. I think both the nature of the problems, such as mental health, create a lot of need and a lot of demand and a lot of burnout on people who are caring and who are stepping in to try to solve these issues. So by the nature of some of the problems, it's difficult and it's challenging, and the system is not perfect, and there are changes that need to be made. The funding is there, but accessing it or navigating the system can be extremely difficult for people. And so you sometimes end up with different results depending on how someone is able to navigate the system, or if someone has advocates, family members, relatives, or loved ones, or appointed professionals who really care for them and are able to do so competently. And sometimes that depends on whatever person is there at the time for that person, and how busy are they? What is their workload or their caseload?
Wow.
Can they take the time to walk this person through?
Wow. As a concluding question, could you share your, the world vision or world view of how do you want to see the country progressing, and then what challenges you want your country to focus on?
Well, in this area, I would like to see more funding directed toward the individuals and families that could provide the care. Because I feel that if people in the community were incentivized adequately, it would encourage them to take the approach that many take in other countries a bit more naturally, of caring for and respecting and cherishing their old, their elderly, and drawing upon that wisdom and respecting it. That's what I believe would be the best step we could take next, would be to take resources which are now going toward for-profit entities and directing them toward the families and the individuals who could then better manage them in a more humane, more caring, more loving manner than what tends to be somewhat institutional.
Thank you. Thank you, Carl.
You're welcome. Thank you.